afternoon, everybody. We are the Pre-PA group, and welcome to our TED Talk. We have compiled our stories about our challenging journeys to becoming a PA. This story sets the stage for why we all chose to do this project. My name is Maria Gonzalez. I'm 19 years old. I just started my first year at LA City College. I also work part-time at a pizza shop near my apartment where I share with my parents and two brothers. My parents are immigrants and they only speak Spanish. I've been struggling to get them healthcare and proper screenings. Only thing is they don't have insurance. They have not been to the doctor for the last 10 years because it's just too expensive. However, now that I'm in college, I'm inspired to be in the medical field to help people in my community like my parents. I want to learn more about the healthcare system so I can help find my parents the proper care. My friend told me the other day about a PA or a physician assistant. I have no idea where to start finding out more about this profession. From what I heard from my friend, I'm very interested in this career. Maria lives in SPA 4. The social determinants of health play a major factor in this story, including the neighborhood she grew up in, limited access to healthcare, and income. My group and I were inspired by stories like Maria's and helping expand the mentorship and early awareness of the PA profession in underserved communities, specifically SPAs 4 and 7. Further, we also strive to improve health equity by increasing the amount of providers in these particular SPAs, which all begins with mentorship and awareness. These are our Healthy People 2030 objectives, and I'll pass it along to Laura.
Okay, here's the idea. Given the past conferences, we decided to continue the tradition. The 6th annual Pre-PA conference via Zoom will provide information and resources for undergraduate students in underserved areas who want to learn more about the PA profession and the application process. Here is our problem statement. Overall, we wanted to expand the programming to bring a comprehensive Pre-PA conference. So students from under-resourced SPAs 4 and 7 need increased awareness of the PA profession and the unique role PAs play in the healthcare system. Additionally, they need accessible resources and guidance through the onerous application process in order to overcome barriers and become strong applicants who can hopefully return to their community to fulfill the shortage of primary care providers and improve health at the individual and population levels. And now here is Candice.
As such, we decided to delve into the literature, which revealed that increased awareness and guidance are crucial along with mentorship. This diversifies the workforce, which enables the providers to return and serve within their communities. So we selected SPAs 4 and 7 because USC and CSULA are housed there. They are medically underserved communities that could benefit from achieving the Healthy People 2030 objectives. SPAs 4 and 7 are both below the federal poverty level, have difficulty accessing care, and did not see a doctor when needed because they could not afford it. So an intervention is needed to provide awareness and mentorship for the future healthcare workforce in these SPAs.
For our needs assessments, we interviewed key stakeholders, which include students from Cal State LA, USC, staff from the USC Pre-Health Office, the East LA Occupational Center, and faculty and staff from our very own PA program. The students served by these entities are mainly from underrepresented backgrounds. And these are some of the themes that arose during the analysis of the interviews. We wanted to highlight a few quotes regarding the resources our community members have access to, as well as the challenges which help shape the conference this year. These are some of the quotes that we wanted to share from admissions regarding how to prepare for the application process, as well as the history of previous pre-PA endeavors, which have led to the current state of the program that was formerly pipelined. One of the great themes that emerged from our interviews was about how the ATED project and pre-PA pathway have worked in silos, but the hope is that they would be brought together. Thus, we worked with our course director, PA Hudson, and 5 members of the class of 2024 We have been intentional about including them in the entire process in order to pave a way for sustainability. Now, back to Laura.
The conference ran from 8 a.m. to 1 p.m. via Zoom at no cost, which was structured around our theme, the evolution of a PA, starting with what is the PA to requirements, CASPA, and followed all the way to being a practicing PA. As part of the community's request, we partnered with Charles Drew, Western, and USC, who answered all admissions-related questions from attendees. We also had a wonderful and diverse panel of practicing PACs, ranging from primary care to specialty practice. These are a few of our various handouts the team created, which are free and reliable resources our students can refer to. And now, here's Heidi.
We had 150 people RSVP, and we're happy to note that all were from our spas. However, on the day of the event, we had only 46 participants attend. Out of those, only 22 participants completed both the pre and post surveys, and we are presenting the quantitative results from those. As you can see here, the vast majority identify as female and are young adults. All participants have completed at least a high school education, and most are in the process of completing their bachelor's degree. Notably, less than a third had heard about the profession before the age of 18, with the majority learning about PAs in their college years. And now I'll pass it to Anna.
By the end of the conference, we wanted our participants to be able to describe primary care and its role in healthcare, as well as the national shortage of primary care providers. The questions we asked in our surveys are listed on the left. Our results show that participants already had a strong understanding of the definition of primary care, which was scored at 95% in the pre and post survey, as well as the role that primary care plays in healthcare, which was scored at 100% in the pre and post survey. Our second objective was for participants to be able to differentiate the scope of practice of a PA and how it differs from an MD, DO, and NP. Our data showed positive results in meeting this objective, as 95% were able to distinguish between the roles and responsibilities of a PA after the conference, compared to 82% before the conference. Further, participant understanding that PAs can work in multiple specialties increased from 77% to 95%, while participant understanding of PA's scope of practice increased from 68% to 91%. Additionally, we wanted participants to differentiate between patient care experience and healthcare experience, as it's often confused. We asked them to categorize CNA experience and front office medical assisting. All participants knew that CNA was considered patient care experience. However, more participants were able to correctly categorize front office medical assisting by the end of the conference, with an increase from 64% to 73%. For our fourth objective, we wanted participants to be able to identify the initial step in applying for financial aid and identify 3 standard sources of financial aid. There was already a strong understanding of the FAFSA application, as 100% of participants were able to identify the initial step to fill out FAFSA before and after the conference. Additionally, the number of participants that were able to identify financial aid resources increased from 91% to 96%. Lastly, we included a few additional questions in our surveys to assess our participants' understanding of PA school requirements before and after the conference. Understanding of general PA school requirements increased from 95% to 100%, while knowledge of the GRE requirement specifically increased from 73% to 91%. However, there was a decrease in comprehension of the key components of the CASPA application from 100% to 95%. Because our sample size is small, this decrease is attributed to one participant. Our presenter did have some connectivity issues during this portion of the presentation, which may have led to some confusion for the participant in answering this question. We were happy to learn that participants were already very interested in the PA profession, as 77% of attendees stated they were very likely, and 18% said they were somewhat likely to pursue a career as a PA. Additionally, prior to the conference, 59% of participants were very interested in going into primary care, and 27% were somewhat likely. However, our post-survey showed that 54% were very likely and 32% were somewhat likely to go into primary care, which was the result of one participant changing their response, as we have a small sample size. Unfortunately, we were not able to ask them why their response changed, but it could have been possible that it was because the PA panelists discussed not having time to eat lunch during the lunch hour while working. Or it's possible that the participant learned through the conference that PAs can work in most specialties and have the option of lateral mobility, which really enticed them. Okay, so now I'm going to hand it off to Heidi.
Using these 4 strategies for effective communication, we established a solid rapport with our participants. To achieve an appropriate degree of health literacy, we utilized the SMOG readability assessment and multiple graphics in the handouts and conference presentation to correspond to a 12th grade reading level. We advocated for our profession by presenting our scope of practice, how we fit into the healthcare system, and the importance of primary care in improving overall population health. We engaged in cultural humility, equity, and inclusion by including panelists and speakers from diverse backgrounds. We provided participants with reliable, accessible, and free resources, and ensured that all participants from our target audience got priority registration to the conference. And now I'll pass it on to Monica.
So now regarding our star wish, our first star was that our conference had 3 program admissions representatives and 3 practicing PA panelists answering questions from the participating attendees. Our second star was that we had intimate breakout rooms where attendees interacted one-on-one with current PA students and received guidance as they start their journeys to becoming a PA. And then our wish is that we wish that we had a greater audience. We had approximately 150 RSVPs and about 50 attended. Several factors contributed to this, but it wasn't limited to holding the conference on a weekend and the time between the RSVP link and the Zoom link being sent out. We also wish the attendees stayed throughout the entire event. There were several people who signed in but did not stay until the very end of our conference. However, overall, we feel that our goals and objectives were met and our attendees were given valuable information. And based on our data analysis, we were able to make an impact with our intervention. Now I'm going to pass it on to Macy.
So as we wrap up our journey, we invite everyone to join us in bringing awareness to the profession by creating more reliable and accessible channels and resources for all, because not only there's a need locally, but also nationally. This would in turn continue to diversify our future workforce. And so as we start to practice, remember where and why you started. Take on a pre-PA student if you can, or mentor a current PA student so we may continue to empower the next generation of healthcare providers. We would like to thank all of our participants and stakeholders. And these are our references. Thank you. And what are the questions that you have for us?